Oh, and I'm just looking this. I'm actually from Children's Hospital of Philadelphia. It's okay. All right, and we have, okay, well, can you give me like 2 minutes apiece on that? Could you? So as, not to tell you this was planned, I'm going to ask for each of our participants to speak for a couple of minutes. I'll ask Mary to start, and then we'll get on after that. Mary?
Thank you, Janann, for your comments, because it really covers, I think, a good summation for the last 2 days. I just wanted to start with this conference is on strategies to limit sugar-sweetened beverages for young children 0 to 5. And we know we have a problem. When I looked at somebody gave me yesterday, Asher Rossinger, the NCHS data brief that had come out in January on consumption among 2 to 19-year-olds for sugar-sweetened beverages. And they found that for ages 2 to 19, this was on Haines data, that 2/3 of kids 2 to 19 had a sugar-sweetened beverage on the day of the survey. Well, the data that was presented yesterday from FITS was that by age 18 months, 27% of kids had a sugar-sweetened beverage. By 3 years of age, 50%. So it really had a sugar-sweetened beverage. So we really have to start young. I mean, I think it's really critical. So we know that. So then it's what do we do? What strategies do we really use? And I think at this conference, yesterday and this morning, all of the different strategies at the local level, the state level, regulations, marketing, campaigns all came out. But I think that we have to remember this is 0 to 5, and some of these methods really work. Like I think taxes are really working. But if we really want the youngest children to really reduce sugar-sweetened beverages, we have to really target at that age group. If you were targeting adolescents, you would target sports drinks and energy drinks and soft drinks. But for the youngest children, they're drinking fruit-flavored drinks. And we don't even have a common name for these drinks. I was looking there, juice drinks, juice beverages, nectars, fruit drinks. They're not 100% fruit juice, but that's what the youngest kids are eating. That's what we're drinking. That's what we really need to focus on. And Healthy Food America did kind of an analysis, Jim Krieger and his group, on these fruit-flavored drinks and found that more than half contain no fruit and most are 10% juice or less. But yet, we know these are being marketed and parents are really confused because they think they're really healthy. And what Jennifer was talking this morning, that the nutrition claims, it's 4.3 claims per package. If you can say something is vitamin C or gluten-free, that's really going to be confusing parents. I think we have to address the nutrition claims, and we really need to focus on fruit-flavored drinks, as well as other SSBs.
Thank you very much.
Thank you as well for your summary. It was really, really good. I can't believe you did that in 20 minutes. The two things I would point to. One is taxes. I think that there's opportunity there to implement them in the right way. I would caution against trying to regulate sweetness. And I say that because you can't, if you're going to do sweetness for beverages in order to wean, you need to do it for the entire food supply. You're going to have to do it for hard candies. You're going to have to do it for ice cream. You're going to have to do it for everything if you want to regulate sweetness. So I would caution against that. But I'll say, as I said yesterday and earlier today, I think targeting the amount of sugar or added sugar more specifically, that would be the ideal, I suppose, given today's focus on added sugars as the tax unit is achievable. It's still a graduated piece. I think that deserves a lot of conversation, how that would impact, because that's going to impact consumption broadly. The other piece is understanding who the partners are. And you need regulations in some cases. no question, as long as it creates a level playing field. Can take longer to implement those. Voluntary partnerships can in fact move more quickly, but then you run the risk of not having a level playing field for everybody that doesn't engage. And that's acceptable if you get the big players. But what's really interesting, I think, sometimes is looking for those partners that are not actually in this room, like the daycare people. There's got to be an association for daycare people, yeah? There is. Yep. There's association for everything. Are they here?
We support
A little louder.
CDC. But the Daycare Association of USA. I mean, okay, so we need to partner with people like that, not the usual suspects.
we also work in coalition on this with the childcare people all the time.
So that's fact.
Yeah.
Okay, good.
Thank you.
Thank you. Steve?
Okay, so I'll just focus on two things. One thing that I think is really important to keep in mind here is that while we're focusing on sugar-sweetened beverages, which is clearly important, which really speaks to the fact that our children 0 to age 5 are getting too many calories, we should also keep in mind that there are many nutrients that our kids 0 to 5 are not getting enough of, which just speaks, I think, in a very important way about diet patterns and the approaches that we should be taking to head towards optimum nutrition. And I think that we need to keep that in mind because ultimately that's what this is about. It's about children gaining weight and growing appropriately, but it's also about setting a baseline for nutrition and patterns that will ultimately lead to the kind of platform that we want for children, school-age children, adolescents, and adults. And then the other point I would make that Janan's talked a little bit about, but I think the issue of taking our guidelines, which I think are evidence-based and are good, but clearly are not being implemented in the right way, and working to figure out better ways of making sure that those guidelines are implemented. That's clearly just one of a number of strategies that we need to think about. But when families regularly see pediatricians and family physicians, there's an opportunity there, and I think, unfortunately, it's not being optimized.
Good. Thank you. Marlene, please.
Thank you. I just wanted to share, we had done some work trying in Howard County to actually try to help parents tell the difference between the fruit drinks and the 100% fruit juice, and we assessed it before and after, and we were completely unsuccessful. It was very hard to teach enough information for, these were parents of Head Start kids. But in thinking about sort of this more generally, I'm starting to wonder if it even matters. Because in terms of the 100% fruit juice, I think there's really an empirical question about what would happen if we really recommended that kids not drink 100% fruit juice up until age 5. Now, there's some concern, but I think it's what would the substitution be? What would happen? So I think that's one issue. Also, I think the recommendation from the AAP, no more than 4 to 6 ounces, we found that people were confused by that. They thought it meant you should have 4 to 6 ounces a day. So I know when we did the health eating research recommendations on beverages, we decided to say 0 to 4 ounces or 0 to 6 ounces for older because we wanted to get that 0 in there so parents understood that. So another issue is flavored milk. We actually have a study coming out on flavored milk. I checked with the journal editor last night saying, can I share it? It'll be published in about a month. But we actually found that there was some rebound effect that kids really did, after flavored milk was removed, start increasing their consumption of the plain milk over time. This was a 2-year study. So I think we need more research there. We also need to look at kids who never had flavored milk in the first place. So the kids who didn't have it in preschool, they get to kindergarten. If they don't have it in kindergarten and it's not in their elementary school, how much plain milk will they be consuming in school? So I think that that's an important research question as well.
Very good. So we have a few questions from the audience, and we'll start with this. So the first one is about early childhood education and in the daycare settings. And it said, should states or cities be providing more support to the programs that participate in the CFP, so the early childhood program, to improve limitations on sugar-sweetened beverages and ideas of how this might move forward? Anyone want to comment on that?
Yeah, I think that's definitely the case, and I think that if we could, once we open it up to the audience, I think somebody like Jerry Henchy could really talk about, she knows more about CACFP than most people do.
Good.
And that she could give her thoughts.
Good, good. And
I would just add one comment. I don't know enough about the program, but whatever is done, it's essential that measurable outcomes be agreed upon at the outset and tracked for efficacy of any program that we put in place. That'd be my, whatever is done, we need to have that in place.
Okay, and I think we will continue that because I found that many people don't understand that federal program at all. It is the smallest among all of these. But the role it has in setting food and beverage standards in daycare is really quite high. But not all daycare centers are involved. So we'll spend some time on that, I think. So this one is sort of leads from sort of what we've been all saying. So how could we think about finding a new term for these less than 100% juice things that appear to be juice products? There's a lot of fake news and stuff, but are they fake juices, or do we? How might we frame them? In a professionally and industry appropriate way. They are a category of beverages that currently have a very strong presence in particularly this age group. I mean, these really are the children who are taking a lot of these. And I didn't know if any of your groups, and again, when we open this up, we can maybe talk more, but how, we don't want to be disparaging, but because we do have to be respectful of the product group, but how could we get that story out there?
My dad would call it bug juice.
Okay.
That's what because that's what they called it at his camp. But I think it's a real problem. In our research, we've called them fruit drinks, but that does have the word fruit in it. So I really do think it's a huge problem. We need to come up with a better term.
Yeah, I actually wonder if maybe this shouldn't be our problem, and we should look at it the other way around, that you should only be allowed to use the word fruit if it actually is 100% fruit.
So I'm not going to disagree with that, but the challenge then will be descriptive terms for flavor, and typically that's fruity, right? Fruity, which is a legitimate descriptive term, but parents take that often as being a fruit content claim when it is not by law. I think a bigger opportunity might be in mandating that any imagery is proportionate to the amount of fruit that's actually contained in the product. So if it's mostly sugar water, then you somehow have to indicate that content relative to the tiny little bits of fruit that are there. And that might be a more interesting way and direct of communicating the content of the product without changing the name.
Right. Well, I want to carry on with that because it really, if we were doing truth in advertising, it would be sugar water with citrus flavor. So, and again, the idea of does it really contain versus flavor, because you can get citrus flavor with citric acid and never have had a lemon or a lime or an orange nearby. But I think those are some of the kinds of things that, like I said, it would have to be part of the dialogue. But if it is water with sugar and citrus flavor, and it doesn't have fruit on the front, it can have whatever, children's toys or, something that at least says we're still marketing this to kids. But I think those are some of the things that would be responsible, that could be done. Not that it will be fast or easy, but I think of all the segments of the market, if that happened, these would be some of the ones whose utility would start to fade in this area. And the adult things are all these liter bottles with water and citrus flavor, and that's what it is. We're not confused by that.
Yeah, I think, Janann, what would really be helpful to have like a session or a task force or a meeting to really specifically focus on these. I mean, in the literature, they're most commonly called fruit-flavored drinks, which is really confusing. To really look specifically at strategies to limit this, including the definition, the packaging. Right now, you can have all the fruit
Anything
you want, and to really look specifically at
That's unique
that.
to the U.S. In Canada, I know this, I'm Canadian by birth and everything, but in Canada, if you put fruit on the front, the size of the fruit has to be proportional to the content. It does. Yeah.
So there'd be a little tiny orange over in the left-hand corner,
No, I think to really explore these would be.
No,
really
I
needed.
agree, and I think in
Not that Canada gets everything right all the time.
Right.
Just to say, we weren't in the Stanley Cup this year.
But the transactional part of the what's next, these are things that need to be done so that we can have the real conversation. So thank you for that. So another question, data on sugar-sweetened beverages for this age group are permeated with disparities. How can researchers and others mobilize to promote change among particularly the Black, Hispanic, the low-income populations of our country? How can we do this sooner rather than later?
I think it needs to be very tailored. I was impressed yesterday with Henrietta was talking about how they could frame it for American Indians and Navajos, that water is sacred. That would really resonate with American Indians. But I think we need to really have tailored messages for the different groups, and that's going to depend on other things.
Right.
One of the things I think we're up against in any pleasurable exercise, whether it's eating or whatever it might be, that for a parent in particular, or for a mom or for dad, it's one of those things that maybe if you're lower socioeconomic, lower income level, you can afford that treat. You can't afford a lot of other things, but you can afford that. And it's a nice thing to be able to do for your child or your wife or your husband or whatever the case might be. And there is that aspect in some of it. And I'm not saying that by way of excuse, but rather to understand that has to be considered in whatever solution is developed, so that there's still opportunities to treat that aren't carrying along so much added sugar.
And I think to carry on, I would agree completely in the sense that we have to recognize that in our cultures, that food or beverages are some of the celebratory, they're part of our ceremonies. They're part of how we call special attention to things. And so it's not that you want to, take these out entirely. When we were doing some of the school food stuff, one of the things that I got fussed at publicly a lot was you're trying to take cupcakes out of school. You're trying to stop having birthday parties every other day in schools. And we really had to reframe it. It's like, if parents can have cupcakes, now they're gourmet cupcakes. Who knew what was going to happen? But, you can have cupcakes at night and weekends. That's under your supervision. That's not something that might need to be done in our very public place of schools and in places where the federal government is subsidizing the feeding program by billions and billions of dollars. None of us are really trying to be food police and say, categorically, never, 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 as the kids get older. The education, though, about don't do it now is going to have to come back to the parental, the home, and the community level. So I think that is going to be one of the hard parts.
So, Janann, I would just add, though, that, we may be not challenging the concept of food as a reward enough, because it fits into a paradigm that we talk about that starts very early in terms of what babies are rewarded for, et cetera. And I do think that better understanding of this would allow us to think about better strategies to deal with it. And the fact that certain kinds of foods are quite rewarding doesn't necessarily mean that that's what we should celebrate with. So I just think it deserves a broader cultural examination if we're going to solve some of the problems we face.
No, I appreciate that, and I would agree with that too, and the idea of how to redirect rewards with other things in this age group that particularly promote child development, like reading, like special toys, honestly, just like the attention of the adult. I mean, those at this age group, those are just incredibly powerful. So, do we know anything about longitudinal behaviors in children who were not sugar-sweetened beverage consumers when they were young? Are they likely to be consumers or lower consumers or higher consumers of these beverages as they get older? So this is part of the old paradigm about if we restrict in this age group and then we let our children out into our crazy culture, are they going to rebound? So do we have any evidence on that related to sugar-sweetened beverages?
I haven't seen any. I think it's really important, going forward, that we could identify any longitudinal data sets. And I was thinking actually of exactly you, Leanne, because you have some of that data.
But there is.
So let us give you a mic because
And Heidi is here, so she can help me out on this. There's a couple papers that came out of the IFPS2 data set where CDC has a longitudinal sample of infants who were followed for the first year of life, and they did a follow-up at age 6. There's a couple papers that came out of that showed that eating sweets during the first year, drinking sweets during the first year, I think it was juice intake, was predicted intake of sweet beverages, I'm pretty sure, at age 6.
Okay, good. Thank you.
Probably due to the consistency of parent behavior. I just want to throw that in.
Right.
You made a point earlier, Jeanette, about alcohol.
Mm-hmm.
We have no problem restricting alcohol. And kids see advertising for that, and they certainly see advertising for that aspirational lifestyle that goes with beer, or it might be with, wine, or whatever the case might be, or Captain Morgan, the rum things. I just had to think about that one. I guess I should be asking, what are the lessons that we can learn from those industries and how they've crafted their message that might be applicable in this case? I don't know that there are any, but I think it might be worth exploring.
Well, that's why I brought it up. When we think about things that we really culturally accept, that children shouldn't have that, and there are a handful of things. So I agree, it's another one of those partnerships that we could look into. Your light's on. Are you good? Okay. So for Marlene and Richard, please recap what you see as the priority of community-generated messaging for sugar-sweetened beverages. And I'm going to make an editorial change to this, because then goes on to say, thinking about popular culture, hip-hop, athletes, and so on. But that wouldn't be to our 2 to 5-year-olds, but it might be to their parents. So the question is, what kind of messaging? What should be the priority of the messaging about not having sugar-sweetened beverages? And then the examples were popular culture people, and which goes to, so the kids aren't going to know about hip-hop, although they might at 4. But the idea, this really is, how do we message to the parents, the community at large? But take it however you will. What would you like to tell us about what should we be pushing for in the foreseeable future?
Right. Well, I think, one thing that was really interesting from when Jennifer's group looked at the toddler milks that were being marketed is it was all about growth and health and development, and I think that those messages are so important to the parents of this age group. So I think if there were a way to to take the healthier beverages and really have the marketing focus on those things. And I'm so out of popular culture, but if there was a popular person who maybe recently had a baby and she was the spokesperson about this is what I give my child, then.
Beyonce just had twins, right?
Oh, well, there you go. This would be a great thing for her to do.
That's like, who's her agent?
Yeah, that's right. But I think really, that the focus is really on, this is how you make sure that your child grows. And that's different than with older children where you're not so worried about growth. But with this age, it's really all about growth.
2 or 3 years ago, I think, Beyonce had a deal with brand Pepsi. Yeah, and it created a lot of noise in the media. It'd be interesting to see what her position would be now. But I do think, to the question, how do you leverage these things? There's opportunity there with, I would say, pop culture figures, sports figures, to really step up and message appropriately. There are also instances, I'm thinking now of the UK, and I can speak specifically to a PepsiCo product. In the UK, I don't believe Blue Can Pepsi is ever advertised, ever. So full calorie, it's not advertised in the UK. There was a decision taken at the time to advertise Pepsi Max, which is a 0-calorie beverage. Interestingly, the fact that it's 0 calorie is never mentioned in the ads. Now, this gets to the stealth piece.
Right.
It gets to the stealth piece because what they advertise is a max taste. Max taste to the max, blah, 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 blah. I thought it was maxed out on caffeine. It's not, but it's the taste. And it's been incredibly successful as a result. And they've maintained their overall market share across carbonated beverages as a result of that shift in emphasis. I don't believe we can target kids 0 to 5 in this. As you mentioned, with that, it has to be targeted to the older folks, their sibs, their parents. But leveraging, I would say leveraging cutting edge approaches with social media and with people. I can't show it, but there's a really interesting ad with Pepsi Max in the UK where there's a billboard that's live, and if you're inside a bus stop and you look, it looks like there's a lion or a tiger running down the sidewalk at you. It's really funny. And if you look that up, but it's that kind of how do you engage with people, communication, to make them say, that's the product I want, as opposed to, that's the product they tell me I can't have. And I think that's the difference. If you focus on that's the product I can't have, difficult. That's the product I want, which is where the pop people are recognized come in.
So to bridge 2 of these, and then there's some hands up, so we'll break the tradition and start some of that now. So to bridge 2 of these, though, and thinking, is laughing a bit about Beyonce, but also, I'm never sure which, but one of the Williams sisters, tennis stars, is pregnant, and Venus, thank you. Serena, okay. So again, thinking about as we're looking for, we know that we need more voices in the African American community, and there, and people having children or other people who have grandchildren is also another way. But I'm sure many of you remember what I think was really an extraordinarily successful campaign for the milk farmers and boards, Got Milk and the Milk Mustache. I must have collected 40 of those for my talks. Every time one would come out, I'd make a slide of it. So we have had examples where we could use this, and I think, again, the focus is For the little ones, it's like, well, what's in the environment? And the environment is mostly determined by the adults and what are they going to bring in. And just to do a maybe more of a leap than is really there, but for the UK story, you know, the more adults have lower sugar sweetened beverages in the home, if they're using diet drinks and that sort of thing, that actually changes what's served to children as well, because it really is a lot of it until you get to be a teen and really out on your own. It's about what's in the refrigerator and the modeled behavior. And we would, of course, like adults to have less sugar exposure as well. So I think there are all sorts of things, and if, you know, from the National Academy's point of view, stepping off from that 2005 marketing report, I think is also something that really should be considered, because we get stuck by people quote that report. And it has that last piece about, in essence, the evidence were not sufficient to say that final piece. And I think that would be another place that we could have another, you know, authoritative body weigh in, because I think there are changes there as well. So we had a comment back here, and then we'll come to the front.
Thanks, Sarah Balda from GW. In terms of relevant, authentic influencers from, you know, real people, but famous people, whether that's broadly famous like Beyonce or locally famous, there may be some learning we can do from tobacco control. Prior to GW, I was at HHS and worked on the FDA's first campaign, the Real Cost campaign, which is a tobacco control campaign. And so they have user fee funded, so they have money to do this, of course,
right,
which is a big thing. But the first piece of the campaign was targeting general youth, but then they did, and I had left at that point. I actually had a baby, so
There you go.
I wasn't around, but they rolled out what they call the Fresh Empire campaign, which was targeting sort of what they called multicultural. And so there may be some learnings, there may be some published data coming out of that. I think they recently published on the general audience campaign. It may have been in an MMWR, I can't recall, but also another example would be the Truth campaign, which again came out of the Master Settlement Agreement. So they're funded through that. So the point, so that's a big piece. But the point is, they use social media, and the Truth campaign is around using social media, and I don't know how successful they were in this, and hopefully they will publish on it so we can learn. But the idea is that you engage real kids who are on social media to, one of the things they talked about was, you know, let's get this message out that, you know, we're not your next customer, tobacco
Right.
companies.
Peer to
I'm
peer
gonna put
and-
my face on my Facebook campaign, and I'm gonna share, you know, these. So there are
Good.
tactics and strategies that older people can seed, but then hand it over. But then I think the question around one of the focus group testing results that I was at HHS for the time when we got some of the focus grouping back on Fresh Empire campaign was around how, and this is not, you know, rocket science, but the importance of authenticity of the messenger. And that person can be the Beyonce, or it can be someone local, a local hip hop artist.
Right.
And they were looking into that. I don't know if they did it anyhow.
So thank you very much. We'll go here next. And then I'll take one more question, then I'm going to go back to these questions because we've still got a good bit of time, but these are responses to things that had been commented on up here.
Thanks. Christina Hecht, University of California Nutrition Policy Institute. Sarah has actually addressed the point that I was planning to make, but if we're advertising for a product, we have a source of funding for that advertising. But there's not a lobby for water, and I'm not really sure how we would advertise against SSB. Brita, for example, had an ad campaign where they sponsored Steph Curry to promote water, but that's really promoting their product. So I think that some of the examples Sarah mentioned are the type of really creative thinking we need to.
going.
Beyonce probably won't do that for free.
But so while we're passing the mic, let me take a comment. There's someone back there. I think we have more hope for water than we've thought about, because there are so many companies now who do bottled water. There are also a couple of the largest food companies in the world who do a lot of water, thinking of Nestle's and Danone. Pepsi and Coke both own big water divisions. So, I mean, in our list of brainstorming to go get people to start doing that. Now, we don't want to just advertise water that comes in bottles or that you have to filter. But I think that's what impressed me in part with the milk campaign. It wasn't buy my milk from my dairy. It was this is a commodity. So anyway, I think we should keep the water people on our list of how might we do this. So did you have a comment
Can I
related?
comment on the water?
Yes.
We'll do her
Yes.
next
Okay.
and then you next.
Yes, this is Joni Eisenberg. I'm with the DC Department of Health. And that was actually my question. I wanted to clarify it and pick up what Richard Black had mentioned. Who is not here in the room? And it's true that there are not daycare people, very important. Even though we all work in coalitions with them, they need to be in the room. The other people, I would love to see the National Academy of Sciences focus in next time on these wonderful gatherings with some of the young people who are the hip hop artists. Beyonce is the superstar. There are hundreds and hundreds of hip hop people who are connecting on both a local level and a national level. I've actually had the opportunity to speak to some of them who are very passionate about this topic, who are known by community youth. So I would love to have an opportunity where we brought some of these people into the room, in addition to other people who can speak to the community, such as clergy,
No, I think
et cetera.
you're absolutely right, and we have that on our list of gaps. And, there are lots of people taking notes that will go into the report.
So I just want to get back to water and having very young children drink water. So my understanding is that the recommendation is not to give your baby water before 6 months, right? Is that right? But then is there a message after 6 months? Okay, now is time to introduce water. And I recall even with my own kids seeing parents giving their kids water in a baby bottle and thinking, well, no, that's odd, because I think that the idea, again, back to this theme of growth, which I think is what's important to parents of this age group, is that you would somehow fill their stomach up with water and then they wouldn't have room for other things. So I think we need to take that on. I mean, I think we need to be very deliberate and intentional. Maybe we need to get the water companies to make little baby bottle waters, that you could give to your toddlers, and try to really push this idea that it's perfectly appropriate and a good idea to give children in this very, from 1 to 5 water.
Well, and I think that's where, when we talk about our messaging isn't clear. And I think we would all recognize that. And it would take some deliberation to get consensus around assuming the water supply was perfectly safe, when is the right time. Because for all that Steve and many of the rest of us worry about obesity, we've also spent half of our career worrying about failure to thrive. And that's where all those concerns are. So I'd like to switch. This is another thing that we did not talk about very much. So the issue of milk alternatives, so the plant-based proteins, we really haven't spoken about. So the question being, how do we educate people about those products and the added sugar in those? As we think forward about grappling with the sugar water with citrus flavors, how would people begin to think about this for children from 1 to 5? So these are the soy milk, the almond milk, the coconut milk, which are now in, they're not just in the very small grocery store that was always alternative. They're now mainstay products.
Yeah, I think the whole issue of flavored milks, which the almond milk and soy milk that might contain a lot of sugar, needs more discussion.
Okay, and the purists, though, would say these are really not milk, so they're going to end up sort of with a category of their own because of the nutrient density and all of that. But I think in capturing the other, then this is something else that should be captured.
I'll just say, big question is, why would we need these milk alternatives for kids 1 to 5? I think that there can be issues of cow's milk protein allergy and some other things, but those are relatively uncommon. And I think to promote the concept that we should be moving kids away from cow's milk to these other products is just a mistaken concept.
Okay.
I just looked up Silk Original Soy Milk Refrigerated, and one pea pod, 1 cup has 6 grams of sugar in it, 8 grams of protein. I don't know that if that's common, and I don't know the category. If that's the typical sugar content, I don't know there's a lot of value in going after that.
Okay,
Yeah.
so gathering the facts, but again, it's something that
Yeah.
is part of what's happening.
Yeah.
So this question is, with time with patients very limited, what strategies do we suggest to help pediatricians and family practice, other child care and oral health care providers to reinforce the messages around sugary beverages? Is that being taught to our residents to bring it up as anticipatory guidance? What are dentists saying both to adults who have children and dentists who are child practice focused? Any thoughts, any experience on these?
Well, I'll just make a general statement, and that is that I think looking at our education of medical students and residents, education around nutrition is woefully inadequate. It's interesting, I read a piece that Walter Willett wrote about even going before medical school, suggesting that we ought to eliminate organic chemistry as a requirement for medical school and have nutrition science as the requirement. And so I think that we really should revisit this, because you could argue that one of the reasons pediatricians are not very good at implementing nutrition advice is that they haven't learned very much about it during their training.
Good. Thank you.
Can I make just a quick comment on the hip hop thing? 'Cause you made the comment about local hip hop people, and I was scrolling through trying to find somebody. I was at a dinner event a few months ago, and this young lady, Dessa, Dessa, is a hip hop artist, and she's very passionate about nutrition, not focused on kids. She was focused on more her own age cohort. But I don't think it's a big leap to get folks like that who are passionate about nutrition, broadly speaking, to say you can have a really big impact if you focus over here and work with us on this other aspect. So I think there's real opportunity. And she was a part of this group and was one of the leaders that was driving the issue forward. A lot of interesting ideas, things that I would never even dreamt of because of where she is coming from.
But I think we need to focus on our age group, because I don't know if hip-hop artists, that might
Musicians.
be, we have to reach
Okay,
the
I'm
parents.
this is something that's an important question, and there are people who understand key opinion leaders stuff. But we are getting a really good question, so I want us to keep going. So this is a question that starts out by reminding us that the FDA has labeling guidance for industry and regulations on how juice and products that purport to be juice are labeled. It's about the percent required, and somebody can remind us of that. I think it's 10% or something. If it's not 100% juice, is a juice drink with a percent, okay, sorry, I'm not doing so well with this. So basically, what are the current labeling requirements? And then if you look at products like the juice, the sugar water with flavors, or something like Sunny D, the question is, how does that fit into current regulations, and are there any relatively easy way forwards on labeling and making it easier for the consumer to understand the difference? So remind me, to be called a juice, is it 10%? How much juice do you have to be,
To be juice, it's 100%.
It's required by law to be 100% juice in order to be called juice.
Okay, but a juice
A
drink.
juice drink is pretty much anything else.
Okay, so
But you have to-
unregulated in that
but-
sense.
You have to put the
but
percentage on
You're
front of.
required by law to put the percentage on the label.
On the front of the label or on the back? Like contains,
I don't think it specifies specifically.
Most put it on the front.
Most put
They'll
it on-
say contains X% juice, not in huge
Or
font.
they'll put it above the nutrition label.
Yeah.
You know, that just really shows how ridiculous all this is, that it can be a juice drink without any juice in it.
Well,
I think though it
5% minimum, I think. Isn't there a
Yeah.
minimum?
I think it has to have some juice in it in order to be called a juice.
Juice drink. Juice drink. Yeah, but it might be 5% minimum.
Right.
Which is
a
not much.
drink, beverage,
I think
or
Mountain Dew.
cocktail.
I think Mountain Dew has 5% orange juice, as it turns out.
Yes, they have it.
there's a slide that Marlene would like to call up. So while we're getting that, let me, there was another question that goes back to, okay, thank you. Marlene, you have to, a mic, either mine or, yeah, come on.
So remember when I was saying that we had such a hard time training parents to tell the difference between regular juice, 100% juice, and juice drinks? So this is one of the ones that we used, and you can see the front. It says made with real fruit juice, with. Okay, but then what it actually is, when you look on the back, is it's water, high fructose corn syrup, and then the juice concentrates. But there's no way from the front of that you can tell. I'm sorry?
Well, it's all natural, which
Yeah,
also-
it's all natural flavor. So this was extremely difficult. And then if you want to go to the next slide, I'll show you the next one. And this was another one. So, and I think also it's interesting that these are brands that you usually think of as being 100% juice. That was Minute Maid, this is V8. And so again, it's fruit medley, and it's really hard to read, but it says something like made with 5 fruit types of fruit or something like that down in the little corner. But again, it's water, sugar are the first 2 ingredients. So I just think it's insanely difficult to tell the difference unless you turn around and really look at the ingredients.
And you have a nutrition background. So it is not surprising that most of us are confused about this kind of thing. I'm going to keep going with my questions a little bit longer. How about artificial fruit flavored, which is that the flavoring's not the real juice, and the idea that then it wouldn't be able to have that all natural ingredients. But is this a big part of, and I guess Marlene would say yes, because that's what you were just showing us, that the devil is in the details and what's there. Okay, so how does the panel believe we need to address the extensive data gaps for the 0 to 5 age group in the immediate future? Specifically for what nutrients, what subpopulations, and I mean, I think that's a really good question. We all hope we can influence the NHANES cycles, but the next cycle is already fixed, so it's after that. But if we, rule the world, what would we ask groups like NHANES or the CDC, people who have the ability to gather data? What?
Can I ask, for clarity, does it make it easier if you say, look, I'm not actually interested in 0 to 6 months because nobody should be consuming this? Or do you have to say, no, we actually have to check to know if infants at 0 to 6 are consuming these products, and then deal with that issue if it exists? That's a question.
Well, my first pass is if you want evidence-based policy, that we actually do need to do
You need
that.
to ask the question.
And sometimes the prioritization or the imperative nature of change comes out of finding out something we didn't believe was happening is happening. So the age groups are really important, but we're playing back and forth between, the food pattern data, the dietary intake data, which then can look at the kinds of things we're talking about today, but it also can go to the specific micronutrients or the grams of fat or those kinds of things. But as pediatricians, we're still stuck sometimes, I think, and our biggest concerns are about getting enough iron and getting enough zinc in translations, and then getting off to a good start so that you don't have too much fat, and the fat you have is healthier fats. But Steve, I want to know what they're eating, just like I want to know, what a 40-year-old is eating, or if I were in geriatrics, I want to know what 80-year-olds are eating. These are evidence. This is the evidence we need to make good policy.
Yeah, I agree with that. I think that we've heard over and over again that we also tend to have more cross-sectional data than we do longitudinal data. So I do think we need to see how these things play out over time. And this is an area where I think it's particularly important because we're talking about whether children get conditioned to certain kinds of tastes or not, and how that plays out in their choices. And as Leanne mentioned before, we need to know, is that a taste thing or is that a parenting thing, and how do the dynamics of that really work? So unfortunately, I think this is sometimes a difficult group to study, and it's, I think, fair to say that there's just never enough funding to do the kinds of studies that ultimately need to be done.
Okay, I'm going to keep us moving a little bit. So there was a question about food as reward, which I think we covered a little bit earlier. This one is partnering with bottled water manufacturers. Not all bottled water contains fluoride, which is thinking of our dental health, and especially children. So there's a conundrum around dealing with bottled water or the other water sources that aren't fluoridated. So comments on this, because we didn't talk about the issue of fluoride, and we deal with that in one way when birth to 12, and then other ways going out. But the issue of what is the water people are drinking? Is it naturally fluoridated, or are there choices? So other than saying we need to put fluoride on the list. So this one, warning labels on sugary beverage advertisements is a way to utilize the industry's large advertising budget to our advantage. I think we saw some things that are being done in other countries yesterday with actual labels that were recognized.
I don't know, I'm not a lawyer, so is that compelled speech or forced speech in this country? I beg your pardon? Right, but what would the warning label be?
So could you take the mic, please? We're not.
No, I'm not a lawyer. I'm just remembering what she said yesterday, Michelle.
Right. Yeah.
Michelle, was it? And basically, she said if it's just accurate information, even if it has a black circle around it, it's just accurate information that you choose to be displaying in that way. That's just what I recall from her saying.
Okay. So we've got probably another 10 minutes. So I'd like to open up the floor if there are issues that we haven't covered or other things that you would like to add commentary on. So we'll start back there, because I think you were going to talk more about early childhood education things for us. Thank you.
All right. So I'm just going to pick up on the question that you had deferred to me, which I think the question was, can state and city initiatives help CACFP? Was that the question? So I think that they can. They definitely can, and they are. I think CACFP is a good partner because, as we've heard, they're serving half the ECE settings. But one thing that's really important to understand is that 75% of those kids are low income. So I think it's well suited to the efforts that are being talked about today. In terms of state and city partnerships, one of the things that I think will also make CACFP a good partner is that if state and city partnerships are looking at reducing sugar-sweetened beverages, in October we'll see the first time that CACFP has a best practice rule to reduce sugar-sweetened beverages, which it did not have before. So any kind of help that people want to give in terms of materials or training for parents or providers, I think would be welcome. Of particular interest within the ECE setting for CACFP for sugar sweetened beverages is probably some of the work around celebrations, because that's a good place to target. So I think that's one way to look at it, looking at the kind of wellness concept within CACFP for early care and education, and looking at the rules that are being implemented now. The other way in which CACFP could partner to the question of state and local initiatives is if there's going to be changes in policy. So like in New York City, when they changed their rules and they said no more sugar sweetened beverages in early child care settings, the CACFP state agency cooperated with them. So then when they would go in to look and see what was going on with CACFP, they would actually look and see whether people were meeting those beverage standards. Okay. So I think that was a good partnership. So.
And part of this, just to, then we'll move on to part of this, this is just the rollout of the work that was done several years ago to come up and again, review the program, modernize it, get it in more compliance, and things are just beginning to get to the daycare centers with
that's right, because
best practices.
We're on the IOM committee that made the recommendations. So this is right, it's being rolled in. So I think in answer to the question, can you have partnerships? I think you definitely can. I would say look at them from the perspective of being able to communicate to the providers around wellness policies, and celebrations is a key thing, as I said, but also they have, they talk to the parents a lot as well. So in family child care, they're 3 times.
Well, there's somebody seeing somebody twice a day. You got to drop off the kid and pick up the kid. I mean,
right.
It's, there's a real relationship here.
Exactly. So I think sugar sweetened beverages is a good topic for CACFP, and there's partnerships. So the last thing, well, I have 2 more things to say. One, I'm really happy that it's included and everyone is talking about it in this day and a half, because it really is an important opportunity. And 2, in terms of the city and state partnerships, it's often done through the CDC funding. Mm-hmm. So there's a lot of work that's been done there. So that includes summits where everyone works together, but it also includes the obesity initiatives looking at sugar sweetened beverages and including CACFP as a partner. So I'm going to hand this topic over to Heidi if you have anything to add.
Okay, I'm really, if you don't mind pausing there, we only have a few minutes left. But let's get a couple of the other things, which are probably different topics, and then we'll come back. So, Leanne, we have here, and then we'll move through. And in the interest of time, make your comments, but let's try see if we can get another 6 or 8 people speaking.
We haven't said a lot about WIC. Do we have somebody here from WIC? From USDA? Well, from...
Right.
Anyway, WIC still includes juice in the package, right?
After 1 year.
After 1 year.
That was one of the new changes.
Right. But if the mother has more than one child, she would get juice, and she's not supposed to give it to this kid who's under 1.
It's a good point. So this is another opportunity.
I think there are some real inconsistencies here. But WIC, it seems to me there are a lot of opportunities to use WIC as a way to reach parents. And we haven't talked much about that.
Right. Well, and I think in some ways we left it as WIC is sort of tuned up and doing a pretty good job and just got reviewed again as a whole nother set of things. But that point's well taken. And again, I think the bravery of getting the juice reduced and then the juice out of the birth to 12 lays the groundwork. It's like who's ever slide like this is impossible and preposterous, oh, maybe we could do it, or, oh, yeah, we don't need to give that out in a federal program. We may be on that trajectory on some of these. I just also want to point out that... Carrying on with the WIC comment.
The Food and Nutrition Service is currently conducting an infant and toddler feeding practices study too. And this has already produced 1 report, actually 2 reports. The infant report was published in January. There are some findings in this report that might add to this conversation, but the full study is in progress and reports are being released intermediately that, again, could illuminate topics that are addressed today.
Good. So more evidence. That's what we need for the next steps. Do you have a question? No. Okay. why don't we start
I
there?
just wanted to follow up on the provider training piece that Steve started to talk a bit about too. One of the things that we learned in our early work with the healthcare insurers is about some of the gaps that the providers have then, even if there is reimbursement for referrals to a registered dietitian and for follow-up visits with a pediatrician, is really that lack of the skill set to have the conversations and to really talk about nutrition and physical activity. So one of the things we're working on, along with the Academy of Medicine and American Academy of Pediatrics, the Bipartisan Policy Center, and a number of other partners, is really to transform the training systems, not only in med schools, but in all affiliated healthcare professional training systems. And just this year, we awarded 3 really innovative programs to get kind of some of the best practices out and start to disseminate them, as well as worked very closely, led by Bill Dietz and Don Bradley, on a set of core competencies. So there's a lot going on in that area that I think you'll see a lot more come from, and a lot more of us that hopefully can get engaged with that conversation about making sure that continues.
And I think, again, all of the things that happen in the public domain really influence the young healthcare providers as well. So the residents and the fellows want to know this. The nurses that are going to be nurse practitioners and provide care want to know this. Okay, a couple of last questions. Tracy? Or comments?
Question, or more of a comment, I think just kind of a couple of things, getting back to the idea of partnerships, and are there other people to think about in terms of the effort to promote water, and also just thinking about culture of health, wraparound kind of unintended consequences of promoting water through water bottles. I mean, I know we've talked about it, and Dan, you did mention that we also have to look at the flip side of that in terms of the environmental disaster that water bottles really do cause. That, you know, the caps can sometimes be recycled, but the bottle itself, it's really hard. They're not. It's not like tin cans, which are 99%, or aluminum cans, which are 99% recyclable. Bottles are not that recycled as well. So another group to think about enlisting are environmental groups, which have been effective advocates on a number of fronts. And it seems like that might be a little more of a win-win to kind of help sort of combat some of the recycling issues.
Sorry, all of these are going to be solvable. I mean, the issue, whether, you know, if that becomes the barrier, what are going to be the next things? And, you know, for all of the talking in the water, I mean, nobody has really mentioned Flint and what went on there per se, but we know that's been a wake-up call. You know, and the idea of the kind of exposure to lead and arsenic, you know, are really not things we can tolerate again. And of course, that's probably going on in hundreds and hundreds of communities. But how do we capture this sense of outrage? Or this was really a bad sort of natural experiment, but it wasn't that natural. How do we use that? Because I really do believe that if we make this an issue, we find the stakeholders, we're willing to do things could be very different. We want safe water for everyone, right? But if we say, these are the children with their very growing brains, and if we mess it up now, it has generational effects. You know, those are the kinds of things that we can use. So I will let you have the last comment, and then we need to close the session.
So I just wanted to also pick up on something Dr. Daniel said about we need to help kind of change the misperceptions around the alternative sources. So for instance, milk, right? Milk has gotten, it seems like, a bad rap over the years. And part of it is, so there's like a little bit of truth about lactose intolerance, but then there's also just this misconception about lactose intolerance. And so everyone in the Black community is not lactose intolerant.
Right, exactly.
But if I believe that as a parent, that then, you know, I think my children are going to be lactose intolerant too, and I'm not going to bring milk into the home and serve it. So I think, or the cow milk allergy and things of that nature that have, you know, come out of the medical community, but I think then ends up getting this uptake within the community at large, and then it gets propagated, and then it's just milk gets just demonized altogether. So I think we need to come back to some of those conversations, and same thing with water, you know, to some degree, in order to be able to better promote these alternative sources, the sugar sweetened beverages.
So I think that's a great way to close, because that really did bring back that someone else that would have been nice to have here would be somebody who is from the milk groups or whatever because of some of those issues. But again, in clinical practice and in public policy, like you said, the misconception of lactose intolerance is huge. So all of these are things that in this comprehensive messaging, and anytime we certainly go to our African American community, we can't ignore that. If you ignore that, we'll have no authenticity. So, wonderful panel. Thank you. Wonderful audience. And I think our future could be very busy and hopefully successful. Thank you all.